Welcome and thanks for joining me on Talk the Walk. I'm Sarah Wong. Vaccinations are the key in the battle against the COVID pandemic. Today we're joined by Civil Service Secretary Patrick Nip, who's tasked with leading Hong Kong's inoculation drive. Thank you very much for sitting down with us, Mr. Secretary.
Thank you, Sarah.
So, how worried is the Hong Kong government about the COVID variant if vaccinations continue to be slow?
Well, at present, we are approaching zero infection, and we hope that these situations will continue. That's why we have to be vigilant in safeguarding importation of cases and also monitoring closely within the community any possible outbreaks. But if we are going to open our borders, cross-boundary travel, and relax business activities, social distancing measures in the community, then we must have a high vaccination rate. So that's why we are very eager to have more people coming out to get their jabs. And since 26th of February this year, the vaccination program has been proceeding smoothly, and also the take-up rate increased gradually. But we want to see a faster pace. And we are glad to see that in recent 2 weeks, there were clearly pretty good uptake. And we hope that this momentum could continue.
How would you evaluate the government performance so far in rolling out the vaccines?
Well, I think for a successful vaccination program, there are some fundamentals. A, supply of vaccines. Fortunately, we have sufficient supply of vaccines. Secondly, we have a choice of vaccines. We have 2 types of vaccines for the public to choose. Thirdly, both vaccines are approved by the World Health Organization for emergency use. So there's no question about their safety, efficacy, and quality. Secondly, we must have a good infrastructure, facilities to facilitate people to get the jabs. We have 29 community vaccination centers. We have more than 1,000 private doctors that people can get the jabs in the clinics. So we have all these facilities ready. And the whole procedure is very efficient, convenient, and you can then receive your certificate, both in hard copy or digital form. So these are the fundamentals. I think we have been doing a good job. As regards the take-up rate, of course, it depends on people's response. And on our part, we have to do the explanation. We have to provide the necessary information and data to the public, so to enable an informed consent to get the jabs. Another issues that we have to tackle is that for those who want to get a jab but have some sort of a worry about whether they're suitable, their conditions is right or not, then we, through various channels, for example, a lot of experts and clinicians come out and through different platforms to explain and to answer queries and questions. So we hope that bit by bit and to do more could ease the public's mind, and so that they are ready to come forward to get the jabs. I'm also glad to see that the whole community coming together, including the private sector, to offer various kinds of so-called incentives to give the recognition, encouragement, and push to people to get the jabs. Of course, the most important point is that early vaccination is for protection of yourself, your loved ones, your family, and also for the whole community to build up a strong defense to guard against any possible future outbreaks, which according to our experts will come. It's just a matter of time.
Now we'll get to the vaccination incentives just in a moment. But before that, I want to ask you about, I know the government has set a deadline for the mass vaccination program. What actions will be taken if Hong Kong fails to reach herd immunity or 70% of vaccination rate by late August?
When you say deadlines, what it actually means is that for the 29 community vaccination centers, it has been operating since late February, 7 days a week, from 8 a.m. to 8 p.m. every day, to enable the public to have easy access to get the jabs. Our plan is to have the CVCs to operate until end September. Because for the next 3 months is a very critical period. So we urge the public to get the first shot before end of August. Now, after September, these 29 CVCs, according to our plan, will no longer be in operation. But I'm sure that the vaccination will continue, but certainly not in such a large scale as at present. There are people who may have, because of their medical conditions, that they want to get a jab, but they could not get it in time, or there are specific groups that vaccinations would need to be continued, etc., etc. So we would arrange for other settings, particularly most likely is the healthcare setting, to do the vaccination. But certainly it will not be in a scale as at present. So it's important for the public, for every one of us, if our condition is pretty clear that there's no problem. So long as you want to get a jab, you will be able to get it. Then do it. Get the first shot before end August. So that's the message.
So what happened after that? If Hong Kong, the vaccination rate is still below 70%, will government ramp up measures to encourage or to boost the vaccination progress?
Well, as I say, as far as vaccination is concerned, I'm sure that there will continue to be some sort of vaccination after September. For example, the Sinovac vaccine could be taken in the private clinics. We have more than 1,000 private doctors providing the vaccination service in private clinics. For BioNTech, I'm sure that a limited number could be administered in healthcare settings, like a hospital authority or some big medical groups, etc. Now, when after September, we know about the percentage, the take-up rate of the vaccination, then we will be very clear about the risk level of the whole community. That means the extent that we can relax the social distancing measures, the extent that we can allow more travel at our airport, at our boundary control points with the mainland, etc. Because the vaccination rate would determine the extent that we can open up or the extent that we can return to normality.
Does that mean a high vaccination take-up, such as 70% of vaccination rate, is the prerequisite of any sort of gathering activity in the future?
Well, I would not put it this way, because in public health, when we decide on the sort of social distancing measures or infection control measures, is an issue of risk assessment and risk management. If we have a high vaccination rate of 70%, then experts will tell you that even if you have a relatively mass gathering or more travel or passenger flow at our Hong Kong airport or with the mainland, then it's still pretty safe, because even if there are new cases coming in and causing an outbreak, because of the defense that we have built up, we are able to stop the wide transmission or a large-scale outbreak, and we can control it very quickly. Now, that would give us the condition to really relax all these social distancing measures or infection control measures or all sorts of restrictions that you and I want to see it, abolished.
Okay.
But the prerequisite is high vaccination rate. And the extent of the vaccination rate would determine the extent that we can remove or relax such restrictions.
All right, speaking of vaccine, I want to move on to the government's latest move on lowering the threshold of vaccination to people aged 12 to 15. But even respiratory disease expert, including Dr. Leung Chi-Chu, said the move would not have a substantial impact on the city's overall immunity. So is the expansion of vaccine coverage worth the risk of potential side effects among young people? And how do you convince parents to let their children to take the vaccine?
Yeah. Firstly, the advisory panel on COVID-19 vaccines, consisting of our experts, examine the data and come to the conclusion that the benefits of having our teenagers aged 12 to 15 getting vaccinated outweighs the risk. Secondly, from the past year's experience, we witnessed the certain number of confirmed cases involving teenagers. And I think at least 3 of them suffer from severe conditions. So the protection of teenagers aged 12 to 15 are also important because the vaccination is for the protection of oneself. So to provide vaccines to protect our youngsters, our teenagers, of course, is very important. Thirdly, look at the data, look at the vaccines administered in other places. The experts also conclude that the vaccines are safe, are effective, and with very good protection. So I think we have to look at the figures, data, science, and medical grounds. And I think all these are very clear.
Last question before the break. So what does it mean for the resumption of face-to-face classes in school?
We all want to have resumption of classes because present arrangements of restricting the classes to half day or even a sudden closure of classes greatly disrupt students' studies and also have a tremendous impact on their growth, on their personal health. But if we can do it, a resumption of full day class and also including a meal break or sports activities in schools, then you need to have a good defense, have a protection. And a high vaccination rate, of course, is very important. And that's why experts are saying that if the students, the teachers have a vaccination rate of about 70 to 80%, then it's pretty safe to resume full day class, meal break, and also sports activities. So that's the objective, that's the aim, that's the target that we should work towards, together with the education sector, together with our healthcare professionals.
So no 70% of vaccination rate, no resumption of full day class, is that correct?
Well, if we could not reach a sufficiently high vaccination rate, of course the extent that the class could resume and also the restrictions that you need to impose, including social distancing measures or infection control measures put in place in schools, would need to be considered. So it's an overall package of measures that you could manage the risk. But of course, the most simple and the simplest and most effective way is to achieve a high vaccination rate.
All right, let's take a short break here. We'll be right back. Stay with us.